Yeah. Now look at this photographs. What do you see in this picture? You see that lots of big pores are there. So this is what is osteoporosis. That whole matrix, it starts melting away. Remember when you see a cheese cube, or if ladies know, if their grandmothers were using a pumice stone, so it looks something like that. And as the bone weakens, from a very rigid substance, it becomes like a very porous substance. So this is like a bone of a osteoporotic person. A layman perceive as a bone. They think हड्डी का काम क्या है? बस एक अपना ढांचा को संभालना. And they think ये तो एक बार ढांचा बन गया, वो जिंदगी भर काम करेगा. पर this is not like this. The bone, it's a dynamic organ. It's a dynamic organ. Once we diagnose a person, that patient has a osteoporosis. Now we have to decide, is it a primary or it's a secondary? Primary means that you have lived your age. Now you're going, it's like you're aging. That is what we say, aging. And second is if the lady has stopped her period. So we use the word menopausal. So these are the primary that everybody has to go through this phase of birth, adolescence, middle-aged, and the aging population. So somewhere, whoever are listening today, maybe some may be from the younger generation, some will be middle-aged, some will be more towards 50s and 60s, like me. And so these are the people who will develop osteoporosis. Then one is a secondary cause. Secondary cause means they are still young, but still they got osteoporosis. So what are the secondary causes? Secondary causes are a medical disease, or a drug intake, or any bad food habits, smoking, alcohol, which can also destroy your bones. And this may result in a very younger age group. In the age group of 20s and 30s and 40s, not the aging. Okay. What are the risk factors for osteoporosis? Shows 4 conditions. One is a potentially modifiable, one is non-modifiable, and one is medicines and medical conditions. What do you mean by non-modifiable? Non-modifiable means that you are born with a particular genetic makeup, and you may be born with a very good quality. So now initially we should talk about only bones in form of calcium and phosphorus and vitamin D and matrix, but now we talk about quality. Quality means it's a good quality of bone. You may have a bone, but the quality will be bad. So okay, that is a non-modifiable thing. Means you're born with a genetic defect, then it's difficult. You cannot modify that genes. Okay. And potentially modifiable are the one which is the cause which is there, and you are able to treat that cause. So that becomes a potentially modifiable. Then third is the medical conditions, which I'll talk to you later. And the fourth one is the medicines, which themselves can be harmful for the bones. But each one of you should pay more attention to this photograph or the picture or the slide of mine. See, one on the left side, I show a genetics, the genes. You have come with a blueprint. Then I'm talking about the bone, peak bone mass, which I will discuss when I come to the next slide. Now look at the food. One side is food. On the left side, on the right side, you find a lot of what we call as a junk food. Now, let me tell you about the food itself. It's become a fad. You are sitting next to a computer, lots of coffee, or you have a Pepsi or a cola, and you're doing your work throughout, and you're going on sipping that thing. So what is that? All your cola drinks, all your coffee, and they are not good for your bones, because the coffee and the cola drinks are bad because they prevent absorption of calcium, and they also prevent the absorption of calcium inside the bone. Alcohol per se destroys the bone itself, where the female gender, they neglect their food. They will be feeding the children and their elderly people or the husband with milk and eggs, but they themselves will forget to take a glass of milk for themselves. And what I'm trying to tell you is, these are the reserve which you take in your adolescent phase, in your 30s, in your pre-pregnancy and post-pregnancy gives you the strength and the tensile strength in the bones. Like your lifestyle is a very, very sedentary, and the bone, which I told you, the dynamic structure or dynamic organ, which requires a lot of walking and exercising for the remodeling to occur. Bone is all the time. What do you mean by remodeling? Remodeling means that the old cells, the bone cells, are destroyed and they undergo apoptosis and a new bone forms. So this happens when you are walking, running, jogging, or you're doing your exercises. Now, a little bit on the exercise too, because there are lots of youngsters will be there who will be going to the gym. A little talk also. Gymming is equivalent to physiotherapy. Gymming is not equal to jogging. Gymming is not equal to your remember one thing. Why? Because I have noticed in 10 years of going to the gym is that the whole focus of the trainer is on in shapes, and you're really not gymming. So what I'm telling you, when I come to the next slide, I will speak more. So this is not in a small nutshell. I've told all the female, the male, the youngster, the old, what about the food, the walking, playing, and your junk food.